I want to take advantage of your expertise in healthcare. It's such a big issue right now. As we look at places like southern Florida, as Texas, even California, is this thing out of control?
I worry that it is, and the spike that we're seeing in cases really interferes with our ability to resume economic activity, as well as posing a potentially tragic health consequence.
So, Larry, in fairness to you, you've been warned about this since the very beginning of Wall Street Week, pretty much, saying this is worse than we think, and we got to really clamp down on it. Is there anything at this point we can do to get control of it again?
Look, David, this was predictable and predicted. We were running with R0, a contagion factor of 2.5 in normal times. When we did lockdown, we brought it down to perhaps 0.8. That meant we could only bring it a very small part of the way back without having the virus explode, unless we had a comprehensive testing, contact tracing, and masking regime. We had none of those things because of a generalized abdication of public responsibility. And this is not actually rocket science. If we test enough people, if people are careful enough about masking, if we contact trace after we test, after we've brought the thing down to a small scale whack-a-mole works, large scale whack-a-mole doesn't. It's not a question of science. It's a question of political will. But I'd be interested in getting Katherine's view on something that I haven't quite been able to figure out looking at the press, which is out of control is a kind of general set of words. But if you had to say, Katherine, if a place like Germany, things are under control, call that a 1. And New York City in April, where the whole thing was completely exploding, call that 100. Where is it you think Texas, Florida, and California are? And where do you think it will peak there? Are we looking at a reprise of New York, or are we looking at something terrible but not that terrible?
Well, I certainly hope that it won't be that terrible. And there are a few things that weigh potentially on the side of it being a little less out of control. And that's that we know a bit better about how the disease spreads. We have some treatment options available that have been developed through understanding what's worked in the past and what hasn't. We don't have the magic bullet that we're hoping for yet. We don't have a vaccine, but I think that the physician and healthcare provider workforce knows a bit better how to manage the conditions to keep people out of ICUs. And we know how important it is to be wearing masks, to be keeping physical distance, to be lowering density. So it does not need to be as bad as New York. The question of whether it will be or not depends on the political will that you've identified and the public's ability to comply with best practices consistently. And you raised a really key point that keeping the levels lower is really important, not just to prevent unnecessary deaths and sickness, but also because it opens up tools we wouldn't otherwise have. You can't do contact tracing when disease is spreading like wildfire, but when the numbers are lower, then you can actually do an even better job at isolating cases, tracing contacts, enforcing quarantines and isolation. So there's a compounding effect when things start to get out of control that you lose valuable tools.
Can I ask you another question, Katherine? Go ahead, Dick.
No, please, Larry, go ahead.
Katherine, something I've wondered, you and I are both in the university sector. A college dorm or a set of college dorms are a lot like a cruise ship. People are engaged in intense social activity. They're close together. They sometimes end up in places they weren't planning to end up. Everybody's trying to have a very good time. I worry that we are launching thousands of cruise ships in September, and people on cruise ships probably aren't that great at obeying the rules and doing what they should. And my experience with 19-year-olds suggests they're not so great at it either. Are you comfortable with the consequences of the degree of resumption of college that we're going to have?
Certainly, there's a lot of variation school to school. I know both of our universities are taking very seriously the protection of our students, staff, faculty, communities, and that means much less dense population than you would ordinarily have. The real question, I think, is making sure that any outbreaks among the student body don't propagate to the staff, faculty, community, neighborhood, where there are going to be higher vulnerabilities in the population. People in that prime age, college age group are less vulnerable, although not invulnerable as many of them may think, but they have much lower mortality and morbidity rates. And making sure that any outbreaks there are caught early, traced, contained will protect the surrounding communities. And that's what I would worry about the most in terms of things like mortality, although of course we're very worried about the health of everyone in our community. So I think there's good cause to be nervous and to be doing an aggressive job of tracking, tracing, and isolating.
My view,
Katherine, if you can, yeah, go ahead, Laurie.
My view, for what it's worth, is that college administrators can de-densify all they want, but 19 and 20-year-olds will be prone to densify themselves, whatever the rules are, and the rules won't be followed. I think the question is whether you can make everybody test.
Sorry, that's why the tracking and tracing is very important.
Exactly. I think I don't believe they're going to keep things safe by de-densifying. It may be that by testing everybody every 3 or 4 days, and then isolating people who test positive, it may be that that will work to keep things under control. And I think that's a real possibility. And I hope that that's what they're banking on, really, rather than banking on the ability to maintain discipline about people visiting other students visiting other students in their rooms, and students not getting into crowded spaces to have parties, or students reliably wearing masks, because I don't think any of that is very likely to happen.